For those of you who do not know, Julie Mickleberry is a fantastic advocate for women's rights as well. She's been actively involved in reproductive justice movement for the last 10 years. Shortly after receiving her bachelor's in women's study from University of California at Santa Barbara in 2001, she began her work with the Santa Barbara-based Planned Parenthood affiliate. As a public affairs associate, she organized coalitions and coordinated grassroots campaigns to raise awareness and support for public policies that promoted access to reproductive health care. After moving to Louisiana, the great state of Louisiana, in 2005, she was hired as a director of public affairs for Planned Parenthood of Gulf Coast, where she coordinates media, advocacy, and legislative efforts concerning national and state reproductive health policies. And so everybody give a warm welcome to Julie Mickleberry.
The wind is blowing. Thank you for the introduction, and thanks everyone for putting this together. What an amazing showing of just feminist power and women's power, and I think if we can continue to do this, we can make real change. The wind is representing the wind of change. I'm feeling it. Right? So I spent a lot of time down here during the legislative session, and I'm so glad that this rally was happening today because we are in week 5 of the Louisiana State Legislature. And you know what the biggest difference between all of you and me and our opponents? What? We trust women. We trust them, right? We believe in women and we trust women. And we believe that every woman should be able to make decisions about her body and about her health care. You know, it's clear that anti-choice, anti-women's lawmakers are pushing dangerous legislation across the nation. But I think it's all too clear about what's happening here in Louisiana, and we all need to be very acutely aware of what's going on right now, in the weeks past and the weeks to come. This year we're facing an uphill battle in the state legislature, particularly in the area of abortion access. You know, rather than focusing on public policies that increase access to family planning services and sex education, they're really fixated on preventing women to access safe legal abortion care. They want to insert themselves, and they being the government, in between a physician and a woman, and they want to make these medical decisions for us. In Louisiana, we're fighting proposals that jeopardize access to vital health care services, bills that undermine a woman's ability to make her own medical decisions, and measures that would criminalize physicians for providing the care that they feel is best for the patients that they see. I'm going to go down a list of legislation that we're monitoring and fighting this year, and it's going to get very detailed and very specific, but I'll tell you what, the devil is in the details, folks. So read up and take action. First one is Senator Sharon Weston Broom's Senate Bill 708. This bill, she says it will empower women, but this bill would require physicians prior to an abortion procedure to display the ultrasound screen so the pregnant woman may view it, to give a simultaneous description of what the ultrasound says or reads, and if present, make the heartbeat audible. The bill also includes criminal penalties for physicians who do not comply with the requirements, even if they feel like it's not in the best interest for a woman to receive this information. This bill assumes that women are incapable of making their own medical decisions. Mind you, over 60% of the women seeking abortion care are already mothers, and they understand the significance and importance of the decision that they're about to make. And they know before they call on the phone to make the appointment that it's the right decision for them. We need to stop shaming women for making these decisions that are best for them and that are best for the families that they're trying so hard to take care of. The other bill that we are watching that is likely to come up next week, so please speak out about this one, is Senator John Alario's bill that restricts abortion at 20 weeks, regardless of a woman's medical circumstances. This is one-size-fits-all legislation, folks, and it's going to cause harm to the women and to their families. It is vital that physicians have the ability to make medical decisions based on the health and well-being of their patients. These are procedures that these are very rare beyond 20 weeks. And the women that are often making these decisions are carrying wanted pregnancies. They want to be pregnant and they want to have a family, and something is going terribly wrong with the pregnancy. And they seek medical attention because it's the right decision for them. It's often the right decision for the fetus. And the state of Louisiana wants to take that power away from women. They want to insert themselves into these private medical decisions, and we need to stop them. Representative Frank Hoffman has also introduced a resolution that asks Congress to bar Planned Parenthood from all federal funding. While the resolution has no immediate effect on Planned Parenthood's ability to provide health care, it sends an outrageous message to Congress that could result in millions of women losing life-saving care across the nation. We're talking about cervical cancer screenings here, folks. We're talking about family planning services. We're talking about breast health. We're talking about basic reproductive health care services. And Representative Hoffman wants to ask Congress to take all of those services away from 3 million women across the nation. As you see, we have our hands full with anti-choice legislation this year. But I want to take the opportunity to point out one progressive piece of legislation that I'm very proud to be working with coalition partners to support. Just last week, the House Education Committee heard HB 820, which is a measure that would allow public schools, actually they would require public schools to provide comprehensive sex education in schools. This bill would ensure that young people have the information that is medically accurate to make responsible choices about their sexual and reproductive health. And it's not just about sex, it's about healthy relationships. And it's about giving people the negotiating skills that they need to develop healthy life skills. This measure came up last week. It was stalled in committee by a vote of 8-8. We are pretty confident that it will come back up, and we're going to need each and every one of you to call that committee to ensure that it makes it out of committee again. And the speakers before me really talked about the importance of reaching out to your legislators. I just need to reinforce that. I think we should all have our senator and our representatives' phone number on speed dial, because that's what the opponents are doing. That's what they're doing. They're there every day at the Capitol. I see them every single day at the Capitol, holding representatives accountable for their actions. We need to do the same thing. It's time to do the same thing. It's time to speak up. It's time to stand up for women's health. And I think we're standing up for something pretty critical here today. We're standing up for trusting women. And I think our next step is for us to move this crowd over to the Capitol steps so they can hear what we have to say. Thank you.